Hi, good day, classmates. This is Edu from the Doctor in Sustainability program. I am here to discuss to you my part in the Module 9, the review and analysis of the M&E used in the Nigeria Malaria ACSM program or the framework. Just to give you a context, this is the framework that I used in our assignment at the FMA 1 when it comes to the use of ACSM framework in the application to social advocacy. All right. Now, moving forward, the Nigeria Malaria ACSM strategic framework, just to give you a context, is a national guide designed to strengthen advocacy, communication, and social mobilization for malaria prevention and control in Nigeria. It actually aims to increase political support, improve public behavior, and enhance coordination among stakeholders through evidence-based and community-driven strategies. The framework has contributed to increased awareness, funding, and collaboration action in Nigeria's fight against malaria. In the Nigerian Malaria's ACSM strategic framework, monitoring and evaluation was really positioned as a critical pillar to ensure that ACSM activities were uh, effectively supported malaria prevention and treatment goals. So highlight the terms effectively supported malaria prevention and treatment goals. So this is the thing that we will be talking about. I'll be walking through you on how the M&E was employed. And additionally, the M&E framework was designed in alignment with the National Malaria Strategic Plan and integrated into broader national health information systems in Nigeria. The very objective of the framework is to increase, not framework, the integration of ACSM uh, as a framework is to increase political commitment and funding for malaria prevention and control through different targeted advocacies. Second is to improve public knowledge, attitudes, and behaviors, or the KAP, regarding malaria prevention, diagnosis, and treatment, and to strengthen coordination and capacity among stakeholders to implement effective advocacy, communication, and ACSM, and social mobilization activities or ACSM activities. Now, our goal is to check whether what are the data being collected, what are the methods used, and the strength no in using those methods, and what have we seen as an area for improvement. All right, before we start, I'd like you to, if ever you want, if you wanted to access the entire briefer of FMA1, you may scan the code on your left side, and to also scan the full ACSM strategic framework guidebook, you may also scan the QR code on the right side of your screen. All right, let's start. In the data collection, the M&E system employed in the NHR Malaria ACSM framework used both process indicators and outcome indicators. Now, process indicators included the number of interpersonal communication sessions or the IPC sessions conducted, media spots aired, community dialogues facilitated, and advocacy meetings held. Now, these indicator have recorded the process involved in the conduct of such activities. For example, what were the processes involved in facilitating community dialogues or meetings, for examples. Second is outcome indicators. This focused on shifts in malaria-related knowledge, attitudes, and practices, or the KEP, as I've mentioned, which includes knowledge of malaria transmission and prevention, bed net usage among pregnant women and children under 5, uptake of artemisinin-based combination therapy or ACTs, and prompt care-seeking behavior. Now, the methods used in the data collection are the following. First, the quantitative surveys. This involve primary household surveys such as malaria indicated surveys and demographic and health surveys. This is to gather national level data on behavioral outcomes. Second is routine data collection. The data from health facilities and program implementers are used now to monitor service delivery and community engagement. This asks the question, what are the current service delivery efforts and what are also the current community engagement being held? Second is qualitative methods. This involves FGD, in-depth interviews, and participatory feedback mechanism. This is to assess message comprehension, cultural acceptability, and communication effectiveness. Fourth is media monitoring. This is to track message reach and consistency in mass media channels. And lastly, the advocacy documentation, which involves meeting reports, policy briefs that were developed, and records of engagements with policymakers to assess advocacy outputs. Now let's look at the strength in using those methods in um, the malaria prevention in terms of class learnings of what have we learned from our class. So first is one of the strengths I have identified is the theory of change-based evaluation. I appreciate this very, very much in analyzing the framework that I used now. The strategy was informed by a results chain linking inputs like the use of media, the conduct of training, and the conduct also of the interpersonal communication to intermediate outcomes such as the KAP knowledge in terms of behavior and long-term goals such as malaria morbidity and mortality reduction, which actually reflects the good use of the theory of change. Second is the mixed methods approach. The integration of both quantitative and qualitative research design allowed for a more nuanced understanding of the program's impact. This actually aligns in the triangulation principle in the development evaluation. Third is the use of national systems, embedding data into the existing national health information management information system, promoted in a lens of sustainability. It's very multidisciplinary, and also it allows institutional learning. Second, lastly, is the process and monitoring, the outcome monitoring, which I've previously mentioned. Measuring what was done, example, the conduct of sessions and what was changed in terms of behavior. The program really showed good results-based management practice. So these are the strengths that I have identified. And let's also try to look at the limitations in some areas for improvement. No? First is limited community-led M&E. Why limited? Though participatory tools were used, M&E system was largely top-down. Integrating participatory monitoring evaluation could have empowered communities to identify indicators that mattered most to them. So it's actually emphasized in the theory of Freire in terms of participation. Attribution challenges. Given the many actors and interventions that occur simultaneously, attributing behavior change solely is a bit difficult in terms of ECSM efforts. A contribution analysis or most significant change technique would have addressed this gap in terms of um, the actors participated in the framework. Third is limited real-time adaptation. The feedback loops were not always designed for rapid learning. Incorporating adaptive M&E such as mobile data collection and real-time dashboards would have allowed for quicker adjustments to strategies. And lastly, the equity lens is missing. While the data was disaggregated by region and gender in national surveys, there was limited emphasis on vulnerable or marginalized groups, such as people with disabilities or persons with disabilities or people in remote communities. An equity focused evaluation lens could have been used to enhance inclusivity, and that is used by UNICEF in 2014. All right. So that's it for the analysis of the nature malaria ACEs framework in terms of how they used, in terms of methods used. Again, to access the briefer of the presentation, you may scan the QR code on your left side. And to also access the full ACES framework, you can also scan the code on your right side. So I hope you get something in this discussion of M&E and analysis and review of M&E. So I hope to get your insights in the discussion forum. Thank you so much and have a good day.